originally the pain medicines were just designed for acute pain, and the problem is that sometimes our pains don't go away.
Kathy Darnell is a nurse practitioner in St. Joseph and has worked for years with patients. Prescribing Schedule III pain medication is a common practice, but the recent reclassification by the U.S. Drug Enforcement Administration of certain painkillers to a Schedule II makes practitioners unable to independently prescribe the drug.
It basically means that we can't do any refills on those medications.
One of the more popular groups of narcotics reclassified is the hydrocodone combination products. Now as a Schedule II, the medication cannot be faxed or electronically sent. This has pharmacy processes changing as well.
We knew it was coming, so we've got it inventoried, we've got it all categorized, we printed out things to let people know it was coming, but the general person just doesn't understand all that, and they don't get it until it hits them in the face. So I think the biggest thing is that those scripts are so voluminous. I mean, there's so many of those drugs that it really impacts the way the prescription flow is affected, and it makes us have to labor a little more intensely just to get one prescription out.
The classification change by the DEA is in response to HCPs being among the most commonly misused medications.
I think the whole goal is maybe to get physicians not to write for it so freely, and maybe look into other alternatives, whether it be anti-inflammatories or whatever, and just not give in to demanding customers that will only settle for something that is controlled when there's a suspicious nature about it.
Patients will need to check with their physician to see what their new policy will be.
Obviously, if there's changes made in the adjusting medication, then you do want to see that patient back in terms of trying to make sure that's the correct dose, they're not having any side effects, that kind of thing. As long as everything is looking well with them, they can come, they may be able to pick up a prescription. Whether or not that is tied to a doctor's visit is really up to the individual provider.